All right, so you can still hear me, right? Great. Good evening, everyone. Thank you for joining us for our virtual meeting on the draft 2024 IR Integrated Report of Surface Water Quality and the 2025 to 2032 Vision for Clean Water Act 303D program. First, I'm going to introduce our team. I am Becky Monahan. I'm the lead for the Integrated Report, and I'll be presenting on the IR tonight. Guido is also here. Guido, do you want to introduce yourself?
Good afternoon, everybody. My name is Guido Yectayo, and I'll be presenting the Vision for the Clean Water Act Section 303D program. I'm with the Water and Science Administration, and I'm the Chief of the Water Quality Modeling Division. Thank you.
Great. Thank you, Guido. And we also have Melinda Cutler with us, who is our Water Quality Standards lead, and she is going to be doing tech support tonight for us. So thank you all for your help running this. A couple of housekeeping items. So we are on the Google Meets platform, which I'm sure you're all aware. I'm sorry about the issues we had with the Google sign-up form. Please note this is being recorded, as I already said, and this slide shows our notice that we post for recordings. I am recording it so that we can post it to our webpage after this meeting as well. Also, for the meeting, I just wanted to highlight that we're going to go through the presentations first. Everybody's going to be on mute, but go ahead and put any questions in the chat. Melinda can help you troubleshoot if you're having any issues hearing or get stuck. And then we've set aside time at the end for questions on the presentations, and I'll unmute everybody at the end. You can either ask your question in the chat or raise your hand and ask verbally. We do suggest, although this is a public meeting, that we keep most of the questions to general or clarifying questions. We are open in our public comment period for the IR and the vision, and so we suggest that any lengthy questions or comments be directed to the department in writing, if possible. So, why hold this meeting? We are, first of all, super glad that you're here. Thank you for coming at 6 o'clock at night on a Thursday. And we're glad that you're interested in the integrated report and vision. The purpose is to share the info, the updated info, and answer any questions that you might have. We also hope to increase the overall awareness of the IR and vision and encourage people to use them for water quality planning. As we've already mentioned, we're happy to take questions here today, but you're welcome to submit questions and comments to us in writing by July 1st of 2024, and we will formally respond to all written comments. So a brief outline, we're going to talk a little background on the IR, some summary and statistics of our data, what's new in the 2024 IR, EJ and climate change, looking ahead, and then Guido will present the 2025 to 2032 vision, and then we will have time for questions. So to jump right in, background, what is the integrated report? For some of you, this will be very familiar since I go over this slide every year. The IR is a biennial report required by the Clean Water Act to assess the water quality status of all of Maryland's waters. It provides us the list of water bodies that are impaired, not impaired, or those that need more information. Doing this helps us identify and prioritize the waters that need TMDLs and restoration to bring them back into good quality, as well as which waters are in good quality and need our protection. This figure is an outline of how the Clean Water Act works, and I'll show you a little bit about where the IR fits in. So the Clean Water Act requires each state, territory, or authorized tribe to, number one, and I labeled these in case you can't see my cursor. Number one, develop water quality standards or goals for all jurisdictional surface waters. So that's up there at the very top. Then two, we need to monitor those waters. And luckily for us, our waters are monitored and the data is collected from many different groups and partners all over Maryland. We've got DNR, MDE, community-based groups, local government, etc. Then 3, the Clean Water Act requires us to assess the water quality status of those jurisdictional waters. And we do that by using our monitoring strategy and our assessment methodologies to compare the data to the water quality standard and determine if the waters are meeting or not meeting that standard. So that's a little bit of the IR, but most of the IR comes in step 4, the actual reporting part. This is where we identify and list those waters that are not meeting water quality standards, which used to be the Section 303D list. But now that we're in the integrated part of the integrated report, we also report on waters that are meeting water quality standards as well. So we report on all of our waters. And that's where we make our assessment decisions and where you see these categories after the number 4. So if I wish you could see my cursor. Can you see my cursor? Not at all. Okay. From the integrated report where you see number 4, if the waters are not impaired, you'll notice that they go in categories 1 or 2. If the waters are unknown, they'll go into category 3. And if the waters are impaired, they'll go into category 5. And a lot of times we get questions on what happens once a water body goes into category 5. Once it goes into category 5, which used to be called the impaired waters list, it triggers a whole host of actions within the department to bring it back into attainment. This likely means that we're going to collect more follow-up data, develop a TMDL, and once we've established that TMDL, the listing goes to category 4A, and then implementation begins with permit requirements, other project partnerships to bring it all back to start all over again with more data, more assessment, and hopefully bringing that back into attainment of category 1 or 2. No matter the category, either 3, 1, 2, 5, any of the 4s, we can start this process all over again. And the goal is to collect more data, do more assessments, and continue the reporting. I sort of just went over these. These are the categories of our assessment decisions. We have them organized in kind of like a stoplight chart color that everybody's familiar with red being the worst, category 5 going all the way up to orange, yellow, and then our categories 1 and 2 being those that are meeting water quality standards. And we have this on our website in case you need it. And we will be showing these colors in our maps, which you'll see some of, and also our charts that we're about to display. So finally, to close out our background section, some of the broader goals of the IR are to implement the Clean Water Act, but also to communicate the status of our water quality to the public and EPA. And this allows us to highlight some of those success stories and also identify some challenges. We also want to identify and bring impaired waters back into attainment, as we mentioned already at the beginning, and protect those waters that are meeting water quality standards. The IR is kind of that 10,000-foot helicopter view and is one of the many reports or tools that could help document Maryland's water quality status. So moving on to the actual report, what is in it? We have some background, we've got descriptions of the state's programs, but the most important pieces are the summaries of the state's water quality, the actual listings and water body pollutant combinations, which we used to put in the report as more static PDF pages in the back of the report, but new this year we have them in an Excel spreadsheet, which is on our webpage that you can download so that you can filter and sort all of our assessments, any of them, not just the listings. So you can do it by basin code, category, water body type, etc. And we hope that that will be much more useful for everybody. Also new and important this year is the 2025 to 2032 Vision for Clean Water Act, Section 303D. which is our method for TMDL prioritization and development that Guido will be presenting on next. So into our assessments and listing data, and we're going to show these data in a couple of different ways to hopefully break down some of the complexities of the assessments. So this is all of the total records that we have for the IR. Right now we have 2,071 assessment records, and this includes what is new for the 2024 IR. So this is just a simple pie chart showing the number of assessment records by IR reporting category, like we said before. So starting with, oh, somebody wants to come in. Thanks, Melinda. Starting with those that are in category 2, we have 32% of our listings meeting. Those are covered by a TMDL at 28%, and then an additional 28% in category 5. And so over the next few slides, we're going to break down those that are in category 5 further. This figure shows the number of impairments in category 5 by pollutant type, but also the difference in that number from the last IR. So the blue bars are from the last IR, which was the combined 2020 and 2022, and the green bars are the 2024 IR number. As you'll notice right off the bat, the largest increase is temperature. We had increases in our category 5 listings for temperature, toxics, and bacteria, and we are going to discuss each of those in more detail later on in the presentation. The largest decreases in category 5 listings are for metals, dissolved anions, which in this case is mostly sulfate, and we're going to discuss both of those in detail as well. One thing I want to highlight for this figure, and I'll try and explain them when we go to figures that are different, is that this is showing the number of assessment records only and does not express the size of the impairment. So none of these figures, charts, tables, anything that I'm going to show you stands alone or is the whole story by itself. It's the collective group of these and how we look at the data in multiple different ways that helps us understand. So jumping into the summary of the category 5 listings, as we kind of already saw, we added 293 new category 5 listings, delisted 45, and created 1 new TMDL in this cycle. Something important to note on this slide is that the number of new impairments are the result of increased monitoring and assessment and are not necessarily indicative of worsening water quality. In many cases, like for temperature, we were assessing locations that hadn't been assessed before for that particular parameter. So this is the first time that they're being listed. Alternatively, the delistings, though, do show documented improvement in water quality. That's because they were first monitored, listed as impaired, and are now meeting standards. So those we are really excited about. So of those 293 new category 5 listings, this table breaks down the parameter groups for those. And again, as you'll see, we have temperature, followed by fecal coliform, and then PFOS in fish tissue. And we will talk more about these in a couple of minutes. And the delistings by parameter type, in case you were curious, the majority were for sulfate, which was due to a threshold change that we'll also discuss, followed by fecal coliform, and then delistings for PCBs in fish tissue. And here's our 1 TMDL, which was approved for TSS in the Baltimore. Somebody's coming in. Thanks, Melinda. And you'll hear more about this probably and other restoration plans. Well, the TMDLs that we're working on and other restoration plans more in the vision when Guido presents. So continuing on our stats a little bit, we went over to the main changes of the category 5 listings, but this chart is a little bit different because it shows all of the other changes and additions that happen throughout an IR cycle. A lot more happens than just the category 5 listings. So this is all of the assessment records, similar to that first pie chart, but it shows the parameter group and the category so that you can see how they're all split up. Again, you'll notice, just like in the beginning, temperature, toxics, and bacteria impairments again due to the new 2024 listings. But interestingly, this chart highlights our work and success in developing TMDLs for nutrients and sediments, since the majority of those assessments you'll see are in orange. So going into a little bit more detail, we're going to break these assessments down by water body type. I know you are probably already getting tired of seeing these traffic light charts, but I promise this will be the last couple here. And now is when we are changing to water body size instead of assessment records. And this is going to show a couple of different trends. So this is estuarine waters, which includes our bay waters. And as you can see, nutrients are the largest impairment here, but they're completely covered by the bay TMDL. That's why they're in bright orange. We can also see that there's been a lot of work on toxics, sediments, and metals that have both TMDLs and waters meeting criteria. So again, this is size of the water body in the reporting category by pollutant. This is for lakes, and again, a theme. Our impairments, major impairments here are nutrients, sediments, and toxics. All three of those have active TMDLs and waters meeting standards. But our successes here in lakes are metals, bacteria, and toxics, as you can see by a lot of green in these bars. Something interesting to note on this one is the trash, the floating debris at the top, the yellow one. And this just highlights why we're looking at the data multiple different ways. All 3,000 acres of this actually come from one assessment unit for floating debris in the Conowingo Reservoir. But the Conowingo Reservoir just happens to be 3,000 acres. So again, just highlighting the differences in the different charts, and these are displayed in the integrated report as well. So just make sure you're checking if we're looking at assessment unit size or if we're looking at assessment records and the count there, because it does differ. Now for rivers, it changes up a little bit. So in organics, which there's mostly our chloride impairments, biology, and then nutrients and sediments are the main parameters causing impairments here. There has been a lot of TMDL work on bacteria, sediments, and nutrients. And again, metals, including mercury and fish tissue, and then some waters for biology are meeting standards. Finally, we're almost done with the stats part. For beaches, we are back to count, and we assessed 77 beaches for the 2024 IR cycle. And we have 38 beaches meeting for category 2, 34 in category 3, and then 9 not meeting in category 5. And we're going to talk more about the beaches on the next few slides. So we've wrapped up our summary statistics, and now I'm going to go into a little bit more detail about the special things that are new. So there's lots going on this cycle, but these are the most notable changes for the 2024 IR. Obviously, you've heard me say 196 new category 5 temperature impairments quite a few times. So we have increased our focus on temperature and obviously have some concerns about climate change. In addition to our 196 new category 5 impairments, this brings us now to a total of 369 impairments in Maryland across 41 different watersheds. Additionally, our friends at DNR conducted some long-term trend analyses and have shown that temperature trends are degrading in both the tidal and non-tidal waters in Maryland. So if you're looking at the figures on your screen here, the trend analyses, these are DNRs, span from 1999 to 2022. And the image on the left with the red dots shows that 89% of stations have warming surface water temperature. And then on the right, it shows that 69% of stations show that those warming temperatures have increased 1 degree Fahrenheit or warmer over that same time span. So all of this warming threatens our cold water species, and MDE and our program specifically, we're taking an active role in protecting those existing cold water streams, which we will discuss further in another slide. I'm sorry, I keep promising next slides, but I promise we'll get there. What else is new is PFOS advisories and listings. So PFOS is one of the more widely studied of the PFAS compounds, and they're also known as forever chemicals. They are an emerging and evolving national and state concern, and one that you've probably been hearing a lot about already. We had our first impairment for PFOS in fish tissue in the last IR. And since then, MDE has collected 150 new fish tissue composites, prioritizing areas specifically with subsistence fishing and possible sources of PFAS. They updated the fish tissue consumption advisory, which led to 106 new fish consumption advisories that you can see on the map here. And this led to 36 new Category 5 listings for PFOS and fish tissue on this IR. TMDL development for these is a priority, which I'm sure Guido will explain more in our vision. And MDE is going to continue PFAS and PFOS monitoring, response, and pollution reduction across Maryland. This is not limited to just surface waters also. Our drinking water and wastewater programs are also preventing PFOS and PFAS exposure through their monitoring and response. In 2024, they actually completed PFAS sampling for all 473 community water systems across Maryland and worked with those where the PFAS concentrations were higher. So we have links. I will be posting this presentation to our website probably tomorrow, and we do have links to the applicable web pages on the presentation so that you can find our web pages on PFAS and fish tissue consumption advisories. So getting to beaches. Maryland, we updated our bacteria assessment methodology in the 2024 IR cycle for shellfish and water contact. We did this to be more consistent with our water quality criteria and to determine which waters more required restoration. In fact, actually, as a quick aside, we updated also the temperature and the fish tissue assessment methodologies. And for the very first time, we held a public comment period separate from this public comment period. So we had a public comment period for them in December of 2023. And so you can find our updated and final assessment methodologies on our website if you want. But back to bacteria, the updated methodology covers a longer time frame to reveal more chronic impairments versus the daily and weekly swimming advisories. And as we already mentioned, in the 2024 IR cycle, there were 9 beaches that were assessed as not meeting standards that may be indicative of a more chronic or reoccurring bacteria issue. So one thing I wanted to highlight here, and the picture here is of our beaches, current beach conditions map, is that for real-time swimming decisions, people really should be accessing this Maryland current beach conditions map. And you'll see that all of our beaches that are listed are in blue, they're open, except for the one little box that says not recommended for swimming by the harbor. But currently all the beaches are open, and this is going to be updated in real time all throughout the swimming season to warn of any advisories, closures, or blooms. As we already mentioned, that's not what the IR is looking for at this time. So it is possible that you will see a beach that's impaired on Category 5 that you can swim in all summer long, and vice versa. There could be a beach that has an advisory on this webpage during the summer, but be listed in Category 2 for the IR. And that is just something having to do with the IR cycle as well, that it's a 2-year cycle process that's almost 2 years behind. So we really wanted to make sure that we're expressing and explaining the difference there this year. We also know that bacteria is a concern for a lot of community-based groups, and we are actively working with those groups to develop a process to integrate more bacteria data into non-beach water assessments. And speaking of community data, in the last IR, we developed a partnership with the Chesapeake Monitoring Cooperative. We call them the CMC, and we obtained the citizen community science data directly from their Data Explorer. The picture in the slide shows a lot of their stations that have data that are included in the Data Explorer. And this cycle, we continued that process with them and included more community-based data into IR assessments than ever before. We had 17 different organizations submit data to us, and we were actually able to use high quality tidal dissolved oxygen data from 3 different organizations. I'll highlight them: Arundel Rivers Federation with some South River Federation data, Blue Water Baltimore, and the Nanticoke Watershed Alliance. And we were able to use their data in the Chesapeake Bay program's DO assessment for the Bay that then goes into the IR. That success was many years in the making, and we know that there's still a lot of work that needs to be done. So we're going to continue working with the CMC and the community groups to decrease the barriers in achieving and documenting high quality data that's necessary for this decision making. We know that it's a long road, and we appreciate all of our partners who have provided their data to us thus far, and also thank you for your patience as we work together to continue this process. And heading into delistings now, this was one of the delistings that I said I would provide more details on, and this is for our sulfate delistings. MDE reevaluated all of our 8-digit watershed listings with sulfate impairments because there was a deficiency in our previous biological stressor ID. We did an extensive literature review and consulted with EPA, and we replaced the sulfate threshold with an ultra-conservative threshold that was based on toxicity studies for a very sensitive benthic species. After reevaluating the data with the updated threshold, 22 of the 26 watersheds that were impaired for sulfate were delisted, and those are the ones here on the map that are gray. However, there were still 4 watersheds that were showing some exceedances of that threshold, and they're going to remain listed, and those are the ones in the pink. So more work to be done on those 4. Finally, 2 things that are not new, but are really important environmental issues and are priorities for Maryland Department of the Environment are environmental justice and climate change. Starting with environmental justice, and I want to read the definition verbatim, which is defined under Maryland state law as equal protection from environmental and public health hazards for all people regardless of race, income, culture, and social status. We at MDE and in our program are working to incorporate EJ into all of our programs and projects. And in fact, MDE developed and released an EJ screening tool in 2022, and I have the link here on this slide, which allows users to identify potential underserved or overburdened communities and can encourage meaningful planning and engagement in these areas. Our program actually recently used the EJ screening tool to plan our lakes monitoring for the 2024 and 25 years, as well as the Vision 2.0, which Guido is going to talk about, in developing the list for TMDL development. One of MDE's goals and one of our program goals is to continue to look for opportunities to include EJ in everything we do and work to address these environmental disparities. And finally, climate change. I know you probably have not heard me say 196 new temperature impairments, and warming surface water trends. Enough tonight, but obviously climate change is a huge concern and a priority for Maryland. So one goal that we've had to address these threats is to better protect our cold water streams. In the image in the bottom left here, and sorry, my cursor is not working, but Maryland's designated use class 3 and 3P cold water streams are the ones that are shown here in green. And these waters are especially vulnerable to impacts from climate change. And we have a cold water advisory committee at MDE that just recently achieved their first objective by documenting 19 existing use determinations for cold water. And I guess you can't see it as well as I had hoped, but the purple, you might see a little bit of purple right in the middle of that green. And there's a little bit of purple throughout. Those purple rivers lines now are the existing uses. And these existing uses are waters that have cold water species and temperatures that are cooler than their current use class specifies. So by documenting them as an existing use, it provides additional cold water protections for the waters and our critters that you can see in the pictures that love our cool and cold waters. The department is also working on temperature TMDLs and expecting that the first one will go out for public review in the next few months. And we're going to continue monitoring for temperature, especially in those use class 3 areas. And finally, looking ahead, even though the IR cycles are 2 years apart, our work is always ongoing. So a few things that we're working on that I wanted to share with you that you can expect to see in future IR reports. Some exciting things. The first one is a Fishing Bay pilot study to measure dissolved oxygen in an entire Chesapeake Bay segment. And you can see kind of our monitoring stations in the bottom left-hand picture. We know that there have been successful reductions in nutrient loads to the bay, but we want to see how DO levels have responded to those reductions. So we're partnering with DNR on this project and have deployed continuous monitors and profilers in Fishing Bay for 3 years to gather enough data to assess this segment. We are also working with Maryland Department of Natural Resources on a process for MS4 county biological data. This, we are hoping to incorporate all biological assessments, MDEs, DNRs, and the county, MS4 counties, to initiate consistency between the methods, the sampling programs, and with more data, we will increase the resolution of all of our biological assessments. So that is in the works. Something I've kind of already mentioned is QA/QC protocols and data quality. But as science and technology and monitoring improve, MDE is also working to collect, document, and use the highest quality data for our decisions. We've assessed more data for this IR than ever before, but ensuring the quality of the data is still a challenge. It's a challenge for us for our MDE data, and we are working to collaborate across programs and divisions, but it's also a challenge with external data. And we've been working with the Chesapeake Monitoring Cooperative and community-based scientists to improve and document and verify data quality. And again, all of you who are working with us, thank you for your patience as we work together to develop this. We are also considering, and you can see our lovely green HAB image from EPA here, adopting the 2019 EPA water quality criteria or swimming advisories for cyanotoxins. So our beaches program is already protecting public health from HABs and will issue advisories for them you'll find those on that beaches website. But with increased surface water temperature, we are likely to see HABs as more of a persistent and ongoing problem for Maryland. So our water quality standards group is looking into HABs criteria and hopefully will help us more with our lake assessments as well. And finally, how to get involved. For the 2024 IR, right now, how you can help and what you can do is submit comments to us by July 1st of 2024. Also, we are already looking into the 2026 IR and getting started. We are going to be soliciting for data this winter. The 2024, December of 2024 will be our data solicitation for the 2026 IR. And so you can click on that webpage and submit data, but really you could submit data at any time. You don't have to wait for the data solicitation call. Also, if you are a community-based group, you can look into working with the Chesapeake Monitoring Cooperative. They are fantastic. And you can contact us at any time with questions or concerns. A couple of other resources that I wanted to put on here. There's that link to the full-length integrated report, and right under it is that database link so that you can click that Excel database and see all of the listings and all of the changes. We have the link to our updated assessment methodologies, and our comment response document is on there as well. And we have various mapping interfaces for our IR. We have our own water quality mapping center. We have a searchable integrated report database. And then we have EPA's How's My Waterway page, which has a lot of new interactive layers, I guess I'll say, and has been really helpful. The only caveat with the last 3 links here is that they don't show draft information. So you are not, unfortunately, going to be able to see this data on a map until it is approved by EPA. But we are hoping that that happens very soon. It will be after July 1st, obviously, but maybe July 2nd. But once it's approved by EPA, we will get those up on our mapping interfaces as quickly as possible. So that's all I have for you. So here's my contact information. Again, we are happy to take questions for everything after Guido's presentation. But if you have any comments or questions for the public comment period, please email me and just make sure that they are in by July 1st, 2024. And now I will turn it over to Guido to go over the 2025 to 2032 vision. So Guido, I will stop sharing and let you go for it.
Thank you, Becky. I'll be presenting the vision for the new vision for the Clean Water Act Section 303D program. Here is an outline of what I'll be presenting today. We'll go through briefly through a background, a description of EPA's new vision. I'll describe the process of identifying priorities and the outcomes, the results that we come up with, and finally, future updates. We learned after Becky's presentation how in our state we determine a list of impairments, and similarly, our program and the state must establish total maximum daily loads of the contaminants that impaired waters can receive without violating water quality standards. In 2013, the Environmental Protection Agency developed a vision for Section 303D of the Clean Water Act and provided guidance to the states in order to prioritize the development of pollution diets for impaired waters, known as TMDLs. This vision is designed to help coordinate and focus efforts to advance the effectiveness of the Clean Water Act. And the time period of this new vision covered, was from 2016 to 2022. And at that time, Maryland provides new vision in the 2016 integrated report. TMDL development is a subset of our program functions. Um, the Watershed Protection, Restoration, and Planning Program has established over 488 TMDLs and 161 water quality analysis to date, and they are all available in our website. I wanted to show you this graph because I wanted to describe the many functions of our program, and that TMDL is not the only thing we do. So it's just a part of our functions. So all these functions that our program plays, or all the functions of our program play a significant role in the development of our new vision for TMDL development. Because of the program's many responsibilities, which require interactions with not only the department programs, but also other state agencies, this new vision reflects a comprehensive strategy to address 303D impairments listings. In 2022, and with lessons learned from the last decade, the Environmental Protection Agency finalized the development of the 2022 to 2032 vision. This new vision is intended to encourage flexibility and innovative approaches for states to implement the Clean Water Act, as well as to identify ways to best use limited resources to lead to restoration and protection, find partnerships, and encourage development of solutions to emerging and difficult water quality issues. So I'm going to be describing now the process of identifying priorities for TMDL development. As we learned from the previous presentation, there is a long list of impairments, and the primary objective under this new vision is to identify which of these impairments we're going to be addressing, and how are we going to prioritize them in the next 8 years covered by the new vision. There were many factors, and there were many factors that were identified and that were taken into consideration. Maryland developed a robust methodology utilizing both objective metrics and subjective best professional judgment to identify these priority listings. Of all the factors that we identified, we grouped them in 4 main categories, which are policy, science, collaboration opportunities, and implementation factors. Using all these factors and metrics that we identified, we conducted a geographic information system analysis, and as well as a weighting exercise for categories that did not have spatial information to be included in the overall analysis. For example, these GIS analysis or geographic information system analysis helped identify regions and watersheds where we want to focus and tackle water quality issues. For example, I think earlier in the previous presentation, we heard about the environmental justice screening tool that the department released in 2022. The tool is being used by MDE staff, permit applicants, and the public to facilitate engagement during permitting and environmental protection processes. This tool incorporates demographic and socioeconomic data with MDE elements like industrial facilities, wastewater treatment plants, and proximity to dams to prioritize EJ concerns. Another piece of information that we use is the Tier 2 watersheds. This piece of information would tell us whether there is assimilative capacity remaining in these watersheds or if there is degradation. So this was also taken into consideration. An additional piece of information was the FEMA digital flood maps, and they were used as a surrogate for climate resiliency metric. So here we identify areas with 100 and 500 years floodplains. And these are the 100 and 500 years effective FEMA floodplains. So we intersected and all this spatial information, and also we combined it with information that we didn't have spatial information and weighted all this information. So the map here indicates the watersheds that can become priorities for TMDL and other plants development. So results of combining the flood, AJ, and Tier 2 layers resulting in scores, and so this gives us a geographic idea where TMDL development could be targeted. Based on all the factors and metrics identified, our program and using also the GIS exercise and the weighting exercise and the knowledge the department has gained over the last 25 years of TMDL development, a priority list for TMDL development was determined. This was, for example, here we can see that something new in this list are the temperature and the PFAS TMDLs, which would be the first of its kind in the state. We also noticed that there is, in the previous presentation, it was mentioned that there is a ton of temperature impairments. But most importantly, you can see in this table that the priority rationale that we use, it's heavily relies on AJ and climate. So very important in our analysis. Finally, and all this information is included in the IR as an appendix. So this table will be available for all of you. But I wanted to point out that since the IR process is conducted every 3 years, and per EPA guidance, the department can reassess its priorities every 2 years. Not all the factors have been considered. Not all the factors and variables that we describe have metrics. So we'll have to revisit, reassess our priority exercises when new information, new science is available. For example, another reason to reassess is that a good number of nutrient and sediment TMDLs have been developed using the Chesapeake Bay Program framework. Currently, this framework is being updated. So this model changes, as well as the high levels of implementation in certain areas of the state, will result in the TMDL documents being updated. Another factor into consideration is that our MDE's stormwater, dam safety, and flood management program is currently working on quantifying flooding impacts and also prioritize their work based on that information. So there is a desire to couple quality and quantity models for similar watersheds to better target and tackle these impairments. Finally, our program will continue working on these priority exercises, again, as new science and new information is available. So if you need any additional information, please contact us, Becky or myself. And if you need information about the TMDL program, please go to our website. Thank you very much.
Thank you, Guido. And just so you all know, for official comments for the public comment period, and the public comment period for the vision is running concurrently, simultaneously with the IR. They're out together, as Guido mentioned. It's an appendix in the IR. If you are planning to comment on the vision, please still send it to me. I will make sure that Guido gets that comment, but it's just easier to facilitate all of the comments coming through one person and making sure that they get answered officially in the IR. So now we have plenty of time for questions. I do see two, Melinda. Should I just start at the top?
Yeah, if you want to start at the top with Marion, that's the first question that came in.
Okay, and actually let me go ahead and, oops, I closed it. Let me unmute you. So now everyone can turn on their microphone at any time, but to do so, you will have to unclick your own mute button when you're ready. So, but let me see if I can get to these questions in the chat. So Marion says, will MDE post their advisories in Swim Guide? Marion, can you come on and tell me which advisories? I'm assuming the beach advisories, and we post them on our MDE website, that beaches website. So there is a Maryland Healthy Beaches website that is hosted within our webpage, and any of the advisories, HABs, closures, other advisories, they all get posted there. And I showed that on my slide. Is that what you meant?
Yeah, I know that. Yeah, Swim Guide is something that's used nationally, and it's a lot more useful. You know, I don't think people like run around looking at the MDE website when they're, you know, planning their activities, but they do use Swim Guide, and you know, their Swim Guide has various sources for their data, but it's very easy to use for, you know, regular people, and you know, it would be really helpful if you all did that.
Okay. Thank you very much for that comment. I will share that with our beaches program and see if they are able to do that.
Yeah, it's not just beaches, it's other water bodies also. People recreate in all of our, you know, lakes and rivers and such, and it's really good to know the water quality status, especially from you guys. Thank you.
Great. Thank you. Oh, I got a note that Matt is looking at Swim Guide right now, and it looks like Maryland's designated beaches are included. However, Heather is the best resource, and I can give you her contact information. Matt, will you just, oh, you just posted it too. Okay. Matt already posted that for you. Great. Thanks, Matt. Okay, Doug Myers, is EJ screen being used to assure monitoring efforts are equitably distributed? Yes, we are working on that. We did that for our lake monitoring, which I mentioned in the presentation. So we have a lake prioritization schema to decide which lakes we're going to monitor next, because there are lots of lakes in Maryland. And we completely shook up that priority list this year and prioritized based on EJ. And we use the EJ screen tool as well as other EJ. There are lots of EJ screening tools out. Maryland MDE's EJ screen is one of them, but there are also other tools. But we did use that to prioritize our monitoring efforts. I can't say that every monitoring effort will be prioritized that way, but we're all working on it. And Matt, you can just go on too. And fish tissue sampling for PFOS, Matt's mentioning, and of course the vision. So, and Guido mentioned the vision, and Doug, you may have asked your question before Guido mentioned the vision. Did that answer it, Doug?
Thank you.
Of course. And there is the link to the EJ screening tool, our MDE EJ screen, on our webpage, and our webpage may link other EJ tools. I'm not sure, but I think EPA has some too. So there are lots out there. And for the 293 new Category 5 assessments, what is the MDE capacity to prepare TMDOs? I will let Guido handle this one, but I do know, Anne, that we do not have to develop one TMDL per one listing.
I would like to say that, and also as Becky pointed out earlier, that you could have a lot of impairments within a watershed. So generally, but not, it's not 100%, but generally our TMDLs are for 8-digit watersheds, MDE 8-digit watersheds. So a lot of impairment segments would be within a TMDL. To your question, if there is capacity, was that the question? Yes, the capacity. I don't think we can develop if we would have 400 water or 300, close to 300 waters. I don't think we have the capacity to develop a TMDL for each watershed. However, as we progress with our pilots, for example, temperature is a good example. We have been working a couple of pilots for the last years. Now we can say that we have a methodology in place that can be easily applied to all the impairments. Now we are in a better place in terms of capacity, I would say, in terms of tackling more, if that answers the question.
Thank you.
And that was also kind of the point of the prioritization and that vision that Guido presented, is we do have a lot of category 5 waters, and we would love to just snap our fingers and have TMDLs. That would be great. But we do have to prioritize which ones get TMDLs first. And as Guido mentioned, now taking EJ and climate change into consideration as we prioritize those. Next question. And again, re-beaches. What was the selection process to choose the 77 beaches for the current IR? Will all beaches eventually be included in future IRs? Great question. So the 77 beaches for the current IR were chosen because they are Beach Act beaches. And Heather Merritt is in charge of our beaches program. And she has certain qualifications of what meets a tier 1, tier 2, and tier 3 beach. And these 77 were chosen this round. I know there are a lot more beaches than 77 because they had almost or exactly or over weekly sampling during the summer season. So that was something that was updated in our assessment methodology that I mentioned went through public review. And that weekly sampling allows us to calculate the geomean and STV thresholds that are in our water quality standards and really do a better job of assessing where those chronic impairments are. So those 77 beaches were the ones with weekly data. Will we include other beaches? Yes, we are hoping to. We also have other community-based groups trying to get data, as somebody already mentioned, and it may have been you, Anne or Marion. People swim in other places in Maryland too. And so we are looking for ways to include other bacteria data for the swimming designated use, the water contact designated use. Does that answer your question?
Yes, thank you.
Of course. And there is Matt's swimming guide. Marion says, thank you. And category 3 beaches. If insufficient data was available for the 2024 IR and monitoring data increases to at least 10 sampling events per 90-day monitoring period, how many years of 10+ event data is required to potentially recategorize a category 3 beach? Great question, Anne. So we are looking at a 5-year data window right now, and category 3 insufficient data means that as we were looking at the 5 years, something was askew, obviously. There may have been 2 years that were meeting and 3 years that weren't meeting, or 3 years that weren't meeting and 2 years meeting, or vice versa, or trends were heading in the wrong direction. So I would say as sampling increases, as water quality gets better, 3 to 4 years of new data because it cycles through. So I would say 3 to 4 years of new data, but that depends on what those 2 years that are kind of falling off also look like. So we had a whole bunch of charts that I'm happy to share with you if you're interested, but we looked at all of the data across the 5 years in a chart, and we had some beaches that had good, bad, good, bad, good, bad, and that could have been a category 3. We also had some that started off with really high bacteria levels and really started to bring it down and get those bacteria levels lower and more towards the water quality standards. Those beaches that looked like that and are bringing their levels down, we would hope that the 2 years of higher level data are, going to fall off, and that would give us the 5 years of data needed to make the decision. But either way, as we're getting 2 years of new data, we're hoping that those category 3s will go one way or another. It is possible that with some of the category 2 beaches, that data will lead us towards a category 3 determination as things change. This is the first year that we've done that, and we're still learning about all of the intricacies of our category 3s there. So to be determined, but I would expect 3 to 4 years of data. Did that answer your question in a very long-winded way?
It certainly provided insight. Thank you.
You're welcome. Doug, it is likely that the large number of temperature impairments can be batched into a single TMDL for larger watersheds, like the BA TMDL does for nutrients. Oh, is it likely that the large number of temperature impairments can be batched into a single TMDL like the Bay TMDL does for nutrients and sediments? Guido?
Yes, the answer is yes. One of the I would like to mention that the approach that we've been using is we're running a process-based mode, which is very data hungry, and it takes time to build, and then so the idea that what we're working on right now is trying to develop a statistical model that it's simpler to develop and it relies on data. So that's one thing that we are trying to implement using all the monitoring that we done we started in 2016, monitoring continuous temperature at many, probably 10 watersheds, 10 AD watersheds in the state. So we have a lot of data, and we finished monitoring in 2022. So one of the ideas that we have is coming up with a statistical model that is simpler and kind of reflects what we have all what we learned in the last years by using more complex models. As you pointed out, Doug, the other alternative is the Bay model. So they are working on the phase 7 model now in the next version of their modeling framework. And so if they do simulate temperature, however, one of the things that we want to be sure is that they simulate all the components and all the information that we require in order to come up with temperature allocations or thermal allocations. And so that's something that certainly can happen in the future. Next question. If I answer your question.
Thanks, Guido. Doug, did he answer it?
Yeah, thank you. And I was especially interested not just where there might be overlap to the Bay TMDL geography, but also if, temperature is one of those things very difficult for an allocation because it might be a limit on a permit that is affecting temperature, but it also might be something that we want to look at non-point source best management practices and stormwater MS4 permits and things like that, each of which can have effects on temperature. So you might address the temperature TMDL in a different way than you would a chemical pollutant.
Absolutely.
Great.
Another thing that it's important to consider is the scale. Generally, the impairments are in cold water systems that are very, very local. And the Bay program, currently in the new version of their model, they're trying to push the limits in terms of resolution. So we might be lucky and if we have an adequate product, right?
Great. Thank you, guys. Next on the list, Rob, long time no see. You had an earlier meeting with me. I'm so sorry. The report and database provides so much useful data and information. Thank you. Thank you to everyone at MDE and beyond who contributed to this report. Thank you, Rob. One thing that would make the draft report more useful is providing GIS data and web maps showing the draft listings. Water body names and HUC codes in the database are helpful, but take much more time to understand and digest compared to a map. Can a map GIS data be provided before the public comment period closes? Rob, great question. I think you asked this question already of me specific to temperature, and I was able to share those temperature listings, but I actually forwarded this question onto EPA already. I asked them if it was easy to get our draft IR data into the How's My Waterway interface and mark it as draft, and they are looking into it. There are no promises, so I highly doubt it will be before the public comment period ends, but it's something that they're looking into if a state has the option to publish their How's My Waterway data. I don't think I can pull together a map of all of the GIS data before the public comment period closes because I have to link our IR assessments with the surface water layers. However, I am very happy to do that for any impairments that you are concerned about. I know likely in Baltimore County, Baltimore City for you. So if you want to contact me and see what we can put together, I'd be happy to do that. And this is something that is a great idea that I shared with EPA as well and would make it easier for all of our users to visualize the IR. So it's something I will definitely take into consideration for the 2026. Thanks, Rob. Okay, Anne. Beaches and assessment method. I would like to thank Rob Hirsch for the comments he submitted during the public comment period for the assessment method, particularly bacteria assessment. I reviewed the responses to BCDPES comments 4 and 5 regarding the 90-day monitoring period. The MDE responses review the Memorial Day to Labor Day interval, a static period, and the potential to include any excursion from the greater than 10% statistical threshold value, even if it doesn't occur in season. Okay, so thanks, Rob. Beaches. Can local health departments see the specific data MDE used for the 2024 IR? Absolutely. Please contact me and I'm happy to share that. And I believe we already did, maybe not with the health departments, but with the counties themselves for at least the 9 impairments and maybe the category 3 beaches. We shared some of our analysis with the counties. I'm not sure if it was with the health departments or not, but I can certainly share the raw data as well. So please contact me. Any other questions? We have 45 minutes left on our agenda, guys. No, we certainly won't do that. Are there any other questions that we can answer right now? Could someone explain assimilative capacity? I'm going to pass this one over to Matt so I don't botch this one. Matt, you thought you were going to get out of this without having to speak, but here you are.
Sure. I'm assuming, Doug, you're asking that question in reference to Tier 2 waters?
Yes.
Okay. Sure. Yeah. I mean, its concept was, of course, borrowed from chemical pollution type of summative capacity, the kind of summative capacity used, to determine what the endpoint is of a TMDL. But, for us, Tier 2, we designate it on the basis of IBI scores, having a Fish and Benthic IBI score 4 and above for both communities at the same location. And a summative capacity, we're basically using it to determine when we consider a Tier 2 stream essentially degraded from a high quality level. So That would basically be, we have a certain baseline score at tier 2 station. We give it some leeway because obviously those scores, like if you were to monitor that location year after year after year, there's some natural variability. Those scores are going to wiggle around a mean. And so we don't want to necessarily assume that a tier 2 stream segment is degraded. So we give it some level of natural variability. And then below that, we basically say it's exceeded the threshold for assimilative capacity, and we would consider it kind of essentially degraded. So it cues up a slightly different process when a project or NPDES permit is applied for in the watershed to a tier 2 stream. So that's kind of the basis for how we describe assimilative capacity. And I'm going to share a link we have, which maybe do a better job of explaining it than I can here off the cuff, but bear with me here a second.
I've seen in some listings about having assimilative capacity for nutrients, for example. And so how does that relate to the IBI score?
So really with tier 2, we're considering it we're using assimilative capacity in the sense of the IBI score itself, not necessarily with chemistry. And I just shared a link actually that kind of describes it in much more detail than I did. And so that basically it's looking at where's your score start. And then we continue to monitor them over time to hopefully make sure that they don't degrade. But when they get below a certain level, we basically said, it's no longer wiggling around a mean, that mean has actually changed. And so then we consider it, essentially a degraded tier 2 stream.
Thanks, Matt. I'll look at that.
Thanks, Matt. Sorry for calling on you randomly.
So I'm here for.
Marion, you had your hand raised.
Yes, this is kind of an follow-up to the assimilative capacity. That when you say a tier 2 water has assimilative capacity, it's basically saying that it can that people can discharge more pollutants into it. Isn't that what it basically means?
So it's the best way to explain it. So with our tier 2 streams, the policy and the regulations don't prohibit all discharges from those. That would be, a different reg. But, basically when someone applies for a permit in a tier 2 watershed, we look at, what are the likely impacts. There's certain impacts that we kind of, we know there's going to be an impact. So we ask for mitigation or minimization, things like that of what they're doing. Similar capacity, we kind of use it more in the sense of like when we've determined that something has changed there. That tier 2 segment is no longer at the same level of water quality when it was originally designated. So either some type of water quality insult has happened since that initial time that has brought down the quality, and now we're monitoring and we're seeing that. But no, the idea with our review process is that no net change is allowed to happen. The only time it is allowed to happen is if the project can make a social and economic justification that essentially outweighs the impact they're going to have to water quality. That being said, tier 2 water still has to meet the base water quality standards. It can't be allowed to degrade below meeting standards, which for us, our IBIs, we generally consider a water body to be meeting standards at IBI level of 3. Tier 2, of course, it requires something greater than that, 4s. So they can't go past that level, even with an SEJ or a social economic justification. But that's essentially the goal of our tier 2 review process is no net change. And the only time a net change is allowed is when an SEJ adequately justifies that impact. And that's all based off Clean Water Act regs.
Thank you, Matt.
Should have had Angel on here.
I know. Angel and Kara work on our tier 2 waters. So do you have it? That was my other resort, is if Matt wasn't here, I was going to say, I will take that question to Angel and Kara. Any other questions? Marie, beaches, follow up to last question. Can you speak to the 90-day period for data? Yes, the 90-day period for data is written into our criteria and is in our water quality standards. When we adopted the 2012 REC criteria, I think this was before I was here, I think there was an option for a 30-day or a 90-day, and we decided on 90. I'm not exactly sure why. And so that is written into our criteria, for better or for worse. Any other questions?
Just to add to that one, I think the reason we chose the 90-day window at the time was, I think the other option you had was a 30 days window. I can't remember the exact, I think in the criteria it said something about 30 days. And oftentimes we didn't have that many samples. Even if you're doing weekly sampling, you might have 4 samples, and we just felt a lot more comfortable making a beach listing decision when you had, at least a minimum of 10. So you have some kind of statistical rigor there, at least a little bit more. So it was largely a decision based on making sure we had enough data to be confident in our assessment.
Thank you, Matt. And is the 90 days static or flexible? The 90 days is actually intended, I think, to be, and it doesn't say rolling, I think, in our criteria, but we have tried a rolling 90-day window and determined that that was not appropriate for bacteria data. So as of right now, this assessment methodology, it is static, but flexible in the fact that we're applying it to a recreational swimming season. So we were going to start another 90-day period and keep it exactly 90 days. But what we saw was that there was some sampling in a 90-day summer season. There may have been 93 days or 94 days or 100 days. And so if we kept it exactly 90 days, there was going to be a whole bunch of data on either end that was an outlier and wouldn't have enough samples to be considered. So we made that 90 days semi-flexible to cover basically for the beaches, the start of sampling to the end of sampling, to include all of that data as one summer season. What we're going to do with that for data collected year round, we are still determining, and we are working with EPA. Coming up on the 2026 IR, we're going to work on this assessment methodology again. We know it is not perfect, but it is better than what we had before. So we are happy to get more input on that. And beach regulations require baseline sampling before Memorial Day. Is baseline data included in the 2024 IR? If it is submitted for the Beaches Act program and submitted with the beaches data, then yes, it is included. And that is something that I'm happy to discuss for future iterations of the IR. If that should not be included for some reason that I'm not sure about yet. Any other questions? I see Anne furiously typing away. Anne, you can come on and ask your question. No more? Okay. I thought she was typing. Okay. Any other questions? Anne, are you sure? She's got 2 thumbs up. She's not typing. Please let me know. Feel free to email me or email Guido with any other questions. We're happy to answer them. We are an open book. We try to be an open book. And if you have any official public comments, please submit them to me as soon as you possibly can. You do not have to wait for July 1st, guys, or, the day before or the day after. Submit them to me as soon as you have them, and I will get working on them. And I will pass along any 2025 to to 2032 vision. Comments to Guido. So if there's nothing else, thank you guys so much for being here. We really do appreciate it. All of these reports are a lot of work, and it means a lot to us that it means a lot to you all as well. So thank you for being here. And have a really great night. You get an extra 40 minutes back. Hooray.
Thanks, you all. Good night.
Thank you. Good night.
Thank you, Becky.
Thanks, Guido. Great work. Thank you, Melinda, for being on. Thank you, Matt, for answering questions. Thanks, Melinda.
No problem. Okay,
Get the recording
Good to
stopped.
go.
There's
recording's still going.
still going. Okay.
I will stop it.